Hello everyone. Today we are going on a journey into the world of left heart failure. This condition affects millions worldwide, but many people don't really understand what's happening inside their bodies when it occurs. We will break it down into three main parts: anatomy and physiology of left heart, pathophysiology of left heart failure, signs and symptoms. Let's dive in. To understand left heart failure, we first need to understand the normal anatomy and physiology of left heart. Key structures of left heart. Left atrium. This is the upper left chamber of the heart. It receives oxygen-rich blood from the lungs through the pulmonary veins. The left atrium acts as a reservoir holding the blood before it flows into the left ventricle. Left ventricle. The left ventricle is the thickest and most muscular chamber of the heart. Its job is to pump oxygenated blood with great force through the aorta to deliver it to every part of your body from your brain to your toes. Mitral valve. This valve sits between the left atrium and the left ventricle. It opens to allow blood to flow from the left atrium into the left ventricle and closes to prevent backflow when the ventricle contracts. Aortic valve, located between the left ventricle and the aorta. The aortic valve opens when the left ventricle contracts, allowing blood to exit the heart and enter the aorta, supplying the entire body. How does blood flow through the heart? The left atrium receives oxygen-rich blood from the lungs and passes to the left ventricle through the mitral valve. When the left ventricle contracts, it powerfully pumps the blood through the aortic valve into the aorta, sending it racing through the arteries to supply oxygen and nutrients to all the tissues and organs of the body. Pathophysiology. Now that we understand the normal function, let's explore what happens in the left heart failure. When the left ventricle becomes weakened or stiff, it loses its ability to pump blood efficiently. This can happen in two main ways. Systolic dysfunction. The heart muscle is weakened and cannot contract forcefully enough. Imagine a stretched out rubber band that has lost its elasticity. It cannot snap back as forcefully as before. Diastolic dysfunction. The heart muscle is too stiff and cannot relax properly to fill the blood between beats. In both cases, the left ventricle fails to pump blood effectively, which leads to decreased cardiac output. Less blood is pumped out of the heart with each beat. Backflow of blood into the lungs. When the left ventricle cannot pump efficiently, blood starts to back up in the left atrium. But it does not stop there. It continues backing up in the pulmonary veins, which are responsible for carrying blood from the lungs to the heart. As a result, pressure builds up in the pulmonary circulation. This increased pressure forces fluid out of the capillaries in the lungs and into alveoli, leading to pulmonary congestion and pulmonary edema. Here's a question for you. Ever tried breathing through a straw? That's what it can feel like when your lungs are filled with fluid. It's hard to get enough air in, and every breath can feel like a struggle. Your body does not just sit back and let this happen. It tries to compensate. When the cardiac output drops, several mechanisms kick in to try to maintain and blood flow to vital organs. The body releases stress hormone like adrenaline to increase heart rate and contractility, trying to get the heart to pump more blood. The kidneys, sensing a drop in blood flow, release renin, which triggers a cascade that leads to the retention of sodium and water. The goal is to increase blood volume and pressure to improve circulation. But here's the catch. While these compensatory mechanisms might work in the short term, over time they place additional strain on the already failing heart. It's like using a worn-out engine to tow a heavy trailer. Eventually, it just cannot keep up. Over time, the left ventricle undergoes structural changes in an attempt to adapt. Hypertrophy. The walls of left ventricle may thicken in response to increased workload, especially in diastolic dysfunction. While this might sound like a good thing, a thicker heart muscle becomes stiff and less compliant, further impairing its ability to fill with blood. Dilation. In systolic dysfunction, the left ventricle may enlarge or dilate. This happens as the heart tries to accommodate more blood to pump out, but a larger heart chamber often means weaker contractions. Think of a stretched out balloon that does not spring back into shape easily. Signs and symptoms. Let's explore the key symptoms of left heart failure and understand why they happen. Shortness of breath or dyspnea. Why does it happen? The fluid buildup in the lungs makes it difficult for oxygen to pass from the air sacs into the bloodstream. This is why patients often feel out of breath, especially during physical activities when the body demands more oxygen. How does it present? It often starts as mild breathlessness during exertion, but as the condition worsens, even walking a short distance or resting can cause breathlessness. Orthopnea. What is orthopnea? This is the shortness of breath that occurs when lying flat. Patient may notice they need to prop themselves up with extra pillows to breathe comfortably while sleeping. Why does it happen? When you lie flat, more blood returns to the heart from the legs and abdomen, increasing the pressure in the already congested lungs, making breathing more difficult. Paroxysmal nocturnal dyspnea or PND. What is PND? This is a sudden awakening from sleep due to severe shortness of breath, often accompanied by coughing or a feeling of suffocation. Why does it happen? At night, when lying down for a while, the fluid that was pooled in the lower body during the day returns to the circulation and floods the lungs, leading to sudden breathlessness. Chronic cough or wheezing. Why does it happen? The cough is usually dry and persistent, especially at night. It can become productive with frothy or even pink-tinged sputum if there is significant pulmonary edema. Wheezing occurs because fluid in the lungs narrows the airways, causing a high-pitched sound during breathing. Fatigue and weakness. Why does it happen? Since the heart cannot pump enough blood to meet the body's needs, organs and muscles don't get sufficient oxygen. This leads to a feeling of constant tiredness and weakness, especially with physical exertion. Cold extremities and cyanosis. What does it look like? Patients may notice their fingers, toes, lips, or earlobes appear bluish or feel cold. Why does it happen? Reduced cardiac outputs lead to poor circulation in the extremities as the body prioritizes blood flow to vital organs like the brain and heart.